Hi, I'm Dr. Mark Beaty, and today we want to talk about blepharoplasty. Blepharoplasty is frequently a part of the facial rejuvenation procedures that we perform, and what it is a big fancy word that means eyelid surgery. So we can effectively improve the appearance of both the upper eyelids and the lower eyelids in patients who have had changes that they've noticed over time and as they age. So let's start with upper eyelid blepharoplasty. This is a procedure designed to reshape the upper lids, usually because there's some sagging skin or muscle. And as we can see in this patient who had some very early changes in her upper eyelids, in both the relaxed and smiling views, just removing that little excess fold of skin, it really opens the lid, brightens the face, and additionally it tends to make makeup easier to apply. Here's another example of a patient with a little bit more progression of upper eyelid skin fold. And you can see the restoration of the natural shape of the eyelid, and since the incision falls right in the normal crease of the upper lid, it becomes completely invisible once it's healed. Provides a much brighter appearance to the face, both relaxed and smiling. Here's an example of a patient that's even a little further progressed in their upper eyelid changes, with a quite distinct fold of both skin and muscle over the lid. And you can see when this is opened back up, it gives a very natural yet rejuvenated and brighter appearance to the face. And finally, let's look at an example where the brow is involved as well. In this gentleman, we see the excess fold of skin of the upper lid, but also the heaviness of the brow out on the lateral aspect of the eye. And just by performing an upper lid blepharoplasty, we can open that area up and provide a more rejuvenated appearance. Now, in the lower lids, the primary problem that we see is a change in the contour of the lid. The reason that this happens is that the fat surrounding the eye pouches out into the eyelid a little bit. And what we're able to do is to recontour that fat and reposition it so that the transition from the lid itself onto the cheek is more natural, as in this example here. And many times, like in this patient, we can actually perform the entire procedure through an incision on the inside of the lid, so it becomes completely invisible. And when we look at the three-quarter view, you can again see the rejuvenated and restored position of not just the lid, but the transition onto the cheek. Here's another example of a patient with bulges of fat in the lower lids that also have created the appearance of a deficit or tear trough underneath the bulge. And after the lower lid blepharoplasty, how this smooths and corrects that transition from the eyelid to the cheek, which is what we expect to see in a youthful face. Many of our patients will need upper and lower eyelid blepharoplasty, and this can be performed at the same time in most cases, allowing one single healing period. And this can create quite a dramatic change for patients who have aging both the upper and lower lids. Now finally, many patients with eyelid issues also have some descent of the brow. It's called brow ptosis, and that simply means that the brows are sagging a little bit. And in these cases, we need to, in order to get the correction we're looking for, elevate the brows, not unnaturally high, but simply back to where their normal position was up on the orbital rim, and that allows a normal and natural and extremely rejuvenated appearance to the entire upper face, eyelids, and forehead. As you can see, there are a wide range of patients who can benefit from blepharoplasty operations. Age ranges that we perform this procedure on start in people's 20s and all the way up into the 70s and 80s can see benefit. Depending on what the specific problem is, working on the upper eyelids, lower eyelids, or both, and even the brow can serve to open and brighten the face, make makeup look better and be easier to apply, and contribute greatly to the rejuvenation of our patients' faces.